I'd like to introduce Mr. Jason Lee. He's a global trustee of the Commons Project. He's chairman of Vantage Asia Holdings, an Asia-focused investment group with interest in property, resources and technology businesses. Jason is a young global leader of the World Economic Forum and was a member of their Global Agenda Council for China. Welcome, Jason.
Thanks, Stephen.
Over to you.
What I might do before jumping into the PowerPoint slides is give everybody a little bit of context for what we call CommonPass and the Common Trust Network and what we're trying to do with it. The first point is to say that we think that vaccine passports will become a part of an overall solution as the world emerges out of COVID for more risk-managed and risk-weighted solutions to gradually open up borders. And the various components of that might be, for instance, a distinction between high-risk countries and low-risk countries. So those countries where the infection rates of COVID are a lot higher might have more stringent requirements versus low-risk countries where transmission rates and community transmission is very low, might have less stringent requirements. A second component might be whether passengers or whether tourists seeking to enter other countries have been vaccinated and whether they can validate and provide assurance that they have been vaccinated and tested. The third is whether they have a place of accommodation where they can effectively either self-quarantine or self-isolate for a required period of time. And then obviously, a testing regime to make sure that when they go into the general community that they are not currently infectious. So we think that the vaccine passports are going to be a part of that, this sort of overall risk-weighted and risk-managed solution, principally for the second piece, so that passengers can validate in a trusted way that they have been vaccinated if they seek to travel and enter other jurisdictions. The second framing point I'd make is around this notion of trust, and that is, during the pandemic, I think everybody saw that it became a lot harder to trust outsiders. And as we look to open up and our economies are opening up, we're going to have to learn how to trust each other again. And at the pointy end of that is simply if somebody presents at our border, at one economy's border, with for instance, a vaccination certificate from another country, and that is simply a piece of paper, say with a stamp on it or a seal on it, saying that, for instance, I've received a particular vaccine on this date and I've had 2 shots and therefore I'm vaccinated. How do we trust that piece of information? Just at a basic level, how do we trust that that particular certificate is legitimate and hasn't been forged? Secondly, how do we trust that the vaccine has been properly administered in the source economy? How do we validate and how do we trust that the vaccine that the person says they've received is actually the vaccine that they've received? And so there are, in order for all economies to open up properly, there are a whole range of trust issues that need to be overcome. And to my third framing point, and the last one, is it's not just about the validation of the information. There needs to be 3 key components of this. One is, I guess, the trusted sources, the laboratories, the vaccination clinics, the sources of the health information, validating that the passenger has been adequately medically treated. That's number one. Number 2 is we need standards that are global and interoperable. In other words, it's not going to work terribly well if one jurisdiction or one economy has one set of standards and all the other economies have different sets of standards, it's going to turn into a mess. So this question of a global standard and global interoperability is very, very important. The third element, of course, is security. We need to make sure that whatever system is put in place is secure. It can't be hacked, or it can't be compromised in any way, because the stakes are so high. So look, with that context, let me quickly introduce what we've been doing with CommonPass and the Common Trust Network. If we could please move to slide 4. I'll skip over the first bits in the interest of time. This provides everybody with a bit of a timeline and the different components of what is encompassed in the work that we've been doing so far. It really started around the middle of 2020 when we launched Common Health. The best way to understand Common Health is the Android version of Apple Health. So on Android phones, it allows users or people to collect and store their own health information and only share it with the parties that they trust. So at the heart of everything that the Commons Project does, the Common Project is the Swiss not-for-profit foundation under which all of this work is auspiced, because we have a fundamental principle that everybody's health information should be in their own hands and not in the hands of corporations or governments. It's a foundational principle that we share. So that is Commonwealth. It's a United States system, and it has been integrated into about 270 healthcare systems in the United States. And it's really a domestic system to say if you've been vaccinated or had a test, or it's not just for COVID, it's for a range of medical records, you can share and validate those medical records with venues, border agencies, businesses, whoever is integrated into the Commonwealth system. Then COVID hit, obviously at the beginning of 2020, and we thought about, well, how do we pivot this solution to try to make a contribution to the COVID world? And so we developed CommonPass. And what CommonPass does is, again, take health information from individuals sourced from trusted sources, such as laboratories or vaccination sites, and it integrates them with the border rules, so entry requirements and immigration requirements of various jurisdictions and economies, and then it produces a QR code or some other code that can be scanned at the point of entry, validating, for instance, that you've been vaccinated or that you have been tested and the test is negative. Surrounding this is an initiative called the Vaccination Credential Initiative, which is a coalition of public and private partners really trying to develop and implement global interoperable standards for sharing digital health credentials. And it's a partnership involving technology companies such as Microsoft and Oracle and Salesforce, governments, medical institutions, etc. And then the final piece of the puzzle is what we call the Common Trust Network, which is the group right and at the end, which was launched in Q1 of this year. And this is, I might just ask if we could move to, no, we'll stay there. Sorry, everyone. We'll stay there. What the Common Trust Network is really that network and ecosystem of validated, trusted data sources. And by data sources, I mean laboratories, vaccination clinics. And to give an example of that, say in a particular economy, somebody says, all right, I've been vaccinated from at a place in that economy. How do we give assurance and give comfort that the place that they have been vaccinated meets a particular set of global standards? That is really the purpose of the Common Trust Network. It's a registry of data sources, in other words, laboratories or vaccination centres or clinics that have been validated and trusted and made part of this network. Next slide, please. So Common Health, I've gone over. If we could skip to the next slide to slide 8, please. So jumping ahead to CommonPass, which is really the application that allows people's health data records to be integrated with immigration rules and then scanned at points of entry. So this is really what is known in the media as a vaccine passport. We have been doing trials of this since October of last year on routes such as London and Newark and Hong Kong and Singapore. We've partnered with airlines such as United, Cathay Pacific, Lufthansa and Qantas. We'd recently completed a number of trials on the repatriation flights back into Australia with Qantas. And we are working with the various departments from a range of governments around the world in terms of integrating our systems with their border agency systems. Next slide, please. For instance, we are now fully operational on all Lufthansa flights between Germany and the United States. That solution is live and available for passengers who are flying from Germany to the US. Next slide, please. And we are also fully operational at a national level in Aruba with JetBlue. So that has been fully integrated into Aruba's entry and immigration system when people are coming from JetBlue flights. Next slide, please. And how it works is when you've booked the flight, CommonPass will tell you these are the particular set of labs where you can go to get tested. The Aruba requirements is that you have to take your test within 72 hours of departure, and that's really clearly specified. So you go and take your test, and then on the app you say, all right, well, I'm happy to share this app, share my test results, and the app will generate a digital certificate in the form of a QR code, assuming you've tested negative. If you've tested positive, you won't be able to fly. And then when you arrive in Aruba, your QR code will be screened and scanned, and hopefully you'll be allowed entry. Next slide, please. At a more detailed level, how it works, as I described, is on the left-hand side, we have the Common Trust data sources. These are the labs and the hospitals, also public health registries. Countries like Australia and New Zealand, for instance, will have central registries, vaccination registries. So when somebody has been vaccinated, for instance, their data will go into a national registry, and that can become a trusted data source as well. So then we integrate those data from those data sources with the entry rules of particular jurisdictions. What does that jurisdiction or that economy need for you to be able to enter that? It could be that you've been vaccinated with these particular vaccines and that you have had a PCR test within 72 hours or 48 hours pre-departure. And if they're the rules, we line up the health data with those rules, and the system will mint a pass, positive or negative, in the form of a QR code or another code, which can then be scanned at the point of entry. Could we please now move to slide 16? These are some of the partners that you can see. It's been an enormous undertaking, obviously, at a global level. We work with a range of health partners, from labs to medical research institutes and public health agencies. Obviously, we work on the technology side with a range of technology partners, principally Microsoft, Oracle, Salesforce, and Clear. And obviously, we work with travel partners, a bunch of the major airlines, as well as systems such as Amadeus, who help us integrate into check-in systems, passenger systems, and other sort of aviation-related digital systems. So that was the last slide that I really wanted to introduce. That is a quick overview of everything that we've been trying to do with CommonPass and the Common Trust Network, hopefully to make a contribution to helping the world open up as soon and as safely as possible.
Thanks, Jason. The Commons project and its various outputs really is quite an extraordinary not-for-profit. And you've achieved so much already. I suppose as we're talking across APEC member economies, I suppose I'd like you to briefly tell us about the difficulties in negotiating trust and supports across such a wide region. And you've obviously managed to do it on so many levels already. But what are the biggest complications in getting people to join in?
Thanks, Stephen. It's a challenging project because not only are there so many moving parts and so many different stakeholders. I've spoken about, there's the technology side and the health side and the government side and the airline side. There's so many different pieces. And sometimes we find that those pieces aren't necessarily coordinated themselves. So as many people on this call would know, when you're talking to a particular government, there's the Department of Health and the Department of Foreign Affairs and the Immigration Department and the Homeland Security Department, and often those departments aren't terribly coordinated either. And so it's been a real challenge just coordinating all the different pieces of this and trying to align people around a common unified set of standards, a common understanding of the best way to do this. That's number one. The coordination point has been challenging. The basic trust point has been challenging as well. Luckily, we have started with between economies that naturally trust each other. For instance, the trials that we've run between the United Kingdom and the United States. Hong Kong and Singapore. There's also been trials between Japan and Singapore. And so these are economies where there is already very high levels of trust, a lot of travel, business-related travel, official travel. So they're very, very used to working with each other. Where things will get more challenging is where we deal with situations between economies where there is a lower level of trust. So there may be certain economies that have less trust towards other economies where they feel that their health systems or their immigration systems or their government systems are less reliable or more vulnerable to compromise, for instance. And so we will need to do a lot of work to reassure governments that the data that we have is trustworthy, and that is the whole point of the Common Trust Network. In order to make it into the Common Trust Network, we have to validate that, say there's a lab in economy A, and economy A, just for argument's sake, does not have the best reputation in terms of transparency or the quality of its healthcare system, etc., etc. So there are a variety of solutions, whether it's the Commons Project sending its own people in there just to validate labs and just checking off that they meet the required standards. But that in a way is the point of it, that if we have a global standard and we can validate that a particular lab or clinic meets those standards, then they can make their way onto the Common Trust Network. And similarly, economies are just going to have to trust if there's a national vaccination registry. Say economy A, its government, establishes a national vaccination registry. If economy B, C, D, E chooses not to trust that vaccination registry, then that is a sovereign decision, really, for those governments.
Yeah, look, and I think it really is, it's a fascinating insight into real-world complexities. And the truth is, this is really complex stuff. And I'm actually personally amazed with what you've achieved. I think it's a huge project. I think it works across a lot of different areas, the whole Commons project as well. And I really wish you well in implementing this, what could be a really fantastic resource for everyone to use. I'm glad it's in your capable hands, and I imagine there's quite a team of people involved because these things are not quick. They're not easy to deal with. but I think the progress that you've made so far really demonstrates how important this is and what a commitment different member economies would need to make to be part of it. So thanks very much for coming online today.
It's a pleasure. Thank you.
Thanks.